They say a nation's future belongs to the young. But what happens when the young are no longer the majority? What happens when a country built on energy and expansion slowly turns gray? In the United States of America, that shift is not a prediction, it's already here. In 2022, the U.S. population reached approximately 333.3 million people. And within that number lies a transformation unlike any the country has ever faced. 17% of Americans are now over age 65. In 1980, that share was only 11%. In just one generation, millions more. Americans have crossed into old age, and the systems built to support them are buckling under the weight of this gray wave. Fade in. Meet Eleanor. She's 72 years old. She's worked as a nurse for 35 years, paid into Social Security, saved what she could. She expected retirement to mean peace. Instead, she cuts pills in half because she can't afford the full dose her doctor prescribed. She's not alone. Today, nearly 10% of seniors in America live in poverty, a higher rate than in many wealthy nations. Medical debt is one of the leading causes. As healthcare advances allow people to live longer, the cost of staying alive grows too. But let's step back. How did we get here? For much of the 20th century, America was a young country. Families were larger, immigration surged, the economy needed strong backs and busy hands. The population pyramid was wide at the bottom, narrow at the top. Then the baby boom generation, nearly 70 million people, began aging. Birth rates slowed. Careers became more demanding. Young adults delayed or avoided having children. Life's expectancy rose. The pyramid inverted. Now more seniors depend on the work of fewer young adults. In 1960, there were 5 workers for every 1 retiree. Soon there may be only 2. That simple math threatens the stability of Social Security, the financial lifeline for over 66 million Americans. Experts warn the fund could face shortfalls within the next decade if reforms don't come. And while money is a struggle, time is an enemy too. Loneliness has become a silent epidemic among older adults. Millions live alone, children moved away, spouses passed on, communities changed. Researchers say loneliness increases early death risk by 29%, not because hearts fail, but because they break. And then there's the healthcare system, overwhelmed, understaffed, underprepared. The number of Americans living with chronic conditions such as diabetes, heart disease, and dementia has surged. Nursing homes can't hire fast enough. Hospitals are clogged with long-term care patients who have nowhere else to go. The U.S. has never had to care for this many elders at once. And the strain is visible everywhere. Pause for a moment. Look around your own life. Think of a teacher who shaped your future, a grandparent who taught you kindness, a neighbor who waved every morning. Now imagine a country that forgets them. But this story is not only about challenges, it's about wisdom and opportunity. Older Americans carry experience no textbook can replace. They vote at the highest rates, they volunteer, they support family with both childcare and income. Many even continue working because their knowledge is still needed. Technology offers new lifelines, virtual doctors, smart homes that assist mobility, communication tools that break isolation. Communities are redesigning to be walkable, accessible, intergenerational. The gray wave could reshape America for the better if the nation accepts that aging is not a burden, but a chapter of life that deserves dignity. Still, urgency is rising. By 2034, for the first time in U.S. history, adults over 65 will outnumber children. What does that mean for schools, for the workforce, for the culture? Will younger generations embrace responsibility or turn away? Will America invest in care or collapse under neglect? Will society choose to honor its elders or ignore the very people who built the country it stands on? This demographic shift forces America to face a new identity, not the land of perpetual youth, but the land of longevity, where growing old should not mean growing invisible. Camera pulls back. Seniors in homes and hospitals in silence. The numbers continue to climb. The clock continues to tick. The future of the United States will not be written only by the young, but also by the millions who have already lived the long story of America. As the nation ages, one truth becomes clear. A country is judged not by the strength of its economy, but by how it treats those who can no longer work for it. The American story isn't ending, it's entering a new chapter. The question remains, when America grows old, will it grow wise?